Hi guys, welcome to another episode of J.M.J vlog. In commemoration of the International Nurses Week, I and my colleagues in the department we decided to hold a program where we enlighten people about hepatitis B and test for hepatitis B. So I will be the one giving this speech or lecture about hepatitis B testing and care and the role of nurses in improving health standards in the community. So let's see how it goes.
Deputy Vice Chancellor, the Registrar, the Bursar, the Librarian, the Dean Student Affairs Unit, the Dean Faculty of Health Sciences, the HODs present here, the Director of Health Services, and my fellow colleagues. I say good evening to you. The topic of interest today is hepatitis B testing and care. The role of nurses in improving health standards in the community. What is hepatitis? Hepatitis refers to an inflammatory condition of the liver. It is commonly caused by a viral infection, but there are other possible causes of hepatitis. This includes autoimmune hepatitis and hepatitis that occurs as a secondary result of medications, drugs, toxins, and alcohol. Autoimmune hepatitis is a disease that occurs when the body makes antibodies against liver tissues. Types of viral hepatitis. We have hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E. Hepatitis B. Hepatitis B is transmitted through contact with infected body fluids such as blood, vaginal secretions, or semen containing the hepatitis B virus. Hepatitis B can cause cirrhosis, which means hardening or scarring of the liver, liver cancer, and even death. Types of hepatitis B. There are two types of hepatitis B, which are acute and chronic hepatitis B. An acute hepatitis happens at the beginning, when one first gets infected with hepatitis B. Many are able to clear it from their body and recover. In fact, this is true of about 4 in 5 adults who are infected. If one is not able to clear the infection within 6 months or longer, one is said to have chronic hepatitis B. It is this chronic hepatitis B that leads to inflammation and serious possible fatal illness of cirrhosis of the liver and liver cancer. Treatment can slow disease progress and increase the chance of survival. We have a diagram depicting normal liver and liver affected with cirrhosis or cirrhosis. A normal liver is supposed to make the body function well, like remove toxins from the body's blood supply, maintains healthy blood sugar, regulates blood clotting, and perform hundreds of other vital functions. But a liver with cirrhosis cannot do all this. So, shouldn't joke with hepatitis. Yeah. How common is hepatitis B? Hepatitis B is fairly common in Africa and the Western Pacific region. Throughout the world, there are about 292 million people who are infected with chronic hepatitis. Symptoms of hepatitis B. We have people who are infected never feel sick. Some who are infected never feel sick, so they don't even know they have it. Others who are newly infected have symptoms which may be minor or intense, and these symptoms include achy muscles or joints, stomach pain, loss of appetite, mild fever, loose stool or diarrhea, lack of energy, constipation, having yellow skin or eyes, jaundice, being sick to the stomach or brown urine. How is hepatitis B spread? Having unprotected sex can spread hepatitis B by sharing or using dirty needles for drug use, tattoos, or piercing. Be mindful where you get your ears or nose pierced. By sharing everyday items that may contain body fluids, including razor blade, toothbrush, jewelry for piercing, and nail clippers. By being treated medically by someone who does not use sterile instruments, you should get a qualified nurse to treat you. Being bitten by someone with the infection can also expose one to contacting hepatitis B. By being born to a pregnant woman with the infection, note that hepatitis B is not spread by the following: kissing on the cheek or lips, coughing or sneezing, hugging, shaking hands or holding hands, eating food that someone with infection has prepared, or breastfeeding. What are the risk factors of getting hepatitis B? Due to the way hepatitis B spread, people most at risk for getting infected include children whose mother has been infected with hepatitis B, children who have been adopted from countries with high rates of hepatitis B infection, people who have unprotected sex or have been diagnosed with sexually transmitted diseases, people who have lived with or work in an institution setting such as prison or group home, healthcare providers and first responders, people who share needles or syringes, people who live in close quarters with a person with chronic hepatitis B infection, and people who are on dialysis. Who are hepatitis B carriers? Hepatitis B carriers are people who have hepatitis B virus in their blood, even though they don't feel sick. Between 6% and 10% of those people who have been infected with the virus, some will become carriers and can even infect others without knowing it. There are over 250 million people in the world who are carriers of hepatitis B, and 10 to 15% of those people reside in India. Children are at the highest risk of being a carrier of hepatitis B. In fact, 9 in 10 infected babies between birth and age 5 carry the virus. So, hepatitis B testing and diagnosis. There are 3 ways to test for hepatitis B, which are blood test, abdominal ultrasound, and liver biopsy. Blood test shows how the body's immune system is responding to the virus. A blood test can also tell if you are immune to the virus. Abdominal ultrasound uses sound waves to show the size and shape of one's liver and how well the blood flows through it. Liver biopsy. A small sample of liver tissue is removed through a tiny incision and sent to the lab for analysis. Hepatitis B virus can be detected within 30 to 60 days of infection. About 70% of adults with hepatitis B develop symptoms which tend to appear an average of 90 days after initial contact with the virus. Management and treatment of hepatitis B. Can hepatitis B be treated? No. Can it be prevented? Yes. And how do we prevent it? Oh, sorry. Management and treatment of hepatitis B. Acute hepatitis B probably won't need medical attention. Instead, doctors will likely suggest getting plenty of rest, drinking lots of fluids, and maintaining a healthy diet to support the body as it fights off the infection. One with chronic hepatitis might be a candidate for drug therapy. Usually, these drugs are taken daily. They help by showing the virus's ability to multiply in the system. So, is there a cure for hepatitis? No. But when managed properly, those living with hepatitis can expect to live a normal life. Can it be prevented? Yes. So how do we prevent hepatitis B? Through the use of hepatitis B vaccine, which is one of the most effective ways to control the disease. By practicing safe sex, using latex or polyurethane condoms or any sexual act, by never sharing personal care items like toothbrush or nail clippers, getting tattoos or piercings only at shops that employ safe hygiene practices, and by asking healthcare providers for blood tests to determine if one has hepatitis B virus or if immune to it. The role of nurses in improving health standards in the community. In improving health standards in the community, nurses work to prevent illness and promote health across the lifespan by identifying barriers to healthy lifestyles and general wellness. Also, nurses play a role of an educator in improving health standards in the community. They spend most time with patients and provide anticipatory guidance about immunizations, nutrition, dietary medication, and safety. Therefore, the role of nurses in improving health standards in our community cannot be downplayed. Rather, strict adherence to their advices medically and strict adherence to medication should be done to help improve
before I respond, I should not forget, the lecture delivered by one of our students, very brilliant presentation.
Yeah, that's the end of the program and presentation. It was nice. In fact, the VC came and commemorated it, like he graced the occasion for us. It was really nice. We weren't expecting that. He's a busy man and we understand, but he came. So he really enjoyed my lecture and he was like, the lecture was a brilliant one. I was so happy. So we also like supplied some kits for testing for hepatitis. A lot of people got tested and we took some what's it called, blood pressure of some people, and it was a nice experience. Seriously, I hope to see more and participate more in this kind of things. So that's the end. See you on another episode of J.M.J vlog. Bye.